Hello, everyone. It's Friday, May the 6th. We've had 10 additional deaths since our last briefing, and you know, that's improvement, but like I've said 1,000 times, it's still tragic beyond belief. We've lost 6,880 West Virginians now, and it's been 2 years of tough stuff, and really, really tough stuff for families like these, and so please keep them in your prayers. That's all I can say. The 6,871st death is a 63-year-old female from Cabell County. The 6,872nd death is a 76-year-old female from Preston County. The 6,873rd death is a 72-year-old female from Wyoming County. The 6,874th death is a 64-year-old female from Raleigh County. The 6,875th death, a 97-year-old male from Pocahontas County. The 6,876th death, a 63-year-old male from Raleigh County. The 6,877th death, a 77-year-old male from Pocahontas County. The 6,878th death, an 84-year-old female from Kanawha County. The 6,879th death, a 90-year-old female from Wood County. And the 6,880th death in West Virginia is a 73-year-old male from Berkeley County. If you're paying really close attention, of all these folks that we lost, the youngest ones were 63 years of age. There was 2 of them, 63 and 164. Absolutely, without any question, we have got to get our booster shots. 50 and older, please take heed and get your booster shots. Our active cases continue to climb. They're now 1,114. We have 364 new positive cases in the last 24 hours. Our daily positivity rate's at 5.59, and our cumulative positive rate is at 8.10. We're right at 495,000 people that have recovered from this dreaded killer. There's still 100 people that are hospitalized in West Virginia, and 24 in the ICU units and 11 on ventilators. We have 48 counties that are in the green and now 7 that are yellow. We got to beware. This dreaded killer's not gone. Dr. Marsh said it the very, very best. There's a way to absolutely manage and absolutely prevent, for all practical purposes, prevent death from this dreaded killer. That's the vaccinations, that's the booster shots. And absolutely, without any question, we all know how safe they are. We still urge everyone to realize that this dreaded killer's not gone. It's not gone. We're going to have to find a way to absolutely live with this dreaded killer, and we can do that. We can do that with vaccines that are very, very safe. Now, we've managed to do that in many, many cases and everything across this country for decades and decades. We can do it with this too, but you got to get vaccinated and you got to get your booster shot. We still make little, slow headway as far as getting people across the finish line with their booster shots, you know, and, you know, the eligibility numbers, you know, from the standpoint of the 65 and older or 50 and older, continue to eke up slow but sure. We wish they would go faster, but nevertheless, they are moving and we are making headway. It's just slow. The new vaccine calculator is up. Dr. Marsh, WVU, General Hoyer, many are to be thanked and everything. They'll remind you of when to get your shots. You know, I remind you over and over about your second booster, especially, you know, I tell you the story right quick. You know, a great friend of mine called me up on the phone and said, Governor, what about getting this second booster shot? What do you think I ought to do? I said, when did you have the other one? When did you have the last one? Oh, it's 6 or 7 months ago. I said, do you like walking around with almost no immunity? Because that's where you're at right now. Oh no, I'm on the way tomorrow. I'm on the way first thing in the morning to get this in. But that's it doesn't take rocket science to figure this out. I mean, all you've got to do is just think, are the vaccines safe? Well, sure they're safe. You know, really and truly. Now, we want to absolutely respect everybody's rights and all their freedoms, and I stand rock solid there. But the vaccines we know are safe. With the vaccines being safe, we know absolutely if the more people are vaccinated, the less people we'll lose, the less people will be hospitalized. We know all of that and everything. The natural immunity helps. We know that too. But with all of this, at the end of the day, life is about stacking the deck in your favor in as many situations as you possibly can. I really believe that God above expects us to use our brain and to really think and everything. That's why I tell the joke all the time and everything, about the man below the dam, where the dam was breaking and it was going to flood. And they sent the park rangers there, and he said, I'm not leaving. God will take care of me. Then all of a sudden the water started coming up. The only way to get to the man's house was a boat. They send a boat. He says, I'm not leaving. God will take care of me. So then they leave again. Then the next way, the only way in the world to get to the man's house is a helicopter. And the man's sitting on the roof of his house. And literally the helicopter is touching down and the people are screaming, get on, get on, get on, jump, get on and everything. And he doesn't, and the man dies. And he's going through the pearly gates of heaven, and God's standing there and saying, he says, why, God, I knew you were going to save me, but why did you let me drown? And he says, I tried 3 times. I sent the park ranger, I sent the boat, and I sent the helicopter. Now you got to do a little bit for yourself, really. And at the end of the day, that's how I feel. And so as we go forward, I really hope that we'll stack the deck in our favor as best we can, and we'll stop these people from dying every day. Long-term care facilities, we have 26 outbreaks. We have no outbreaks in our church community, 9 inmate and 6 staff cases in corrections. The rental assistance program is still open for landlords and renters, and we need you to just call and see if we can get you qualified. The same thing with homeowners, the homeowners assistance program. It's an incredible program. Can put real dollars in everybody's pocket if you'll just call and let us walk you through it and see if we can get you qualified. I remind you about giving blood. It can't be more important, and especially if you've survived this dreaded killer and everything, check with your physician and see if they think it's wise, and if they do, really consider giving blood. Jumpstart program absolutely is working, and it's worked right from the get-go. It's a $1,500 check. It's open right now for people that are still unemployed and everything. If they can go get them a job and they can stay on the job for 8 weeks, we send a check. It's just as simple as that. Copied the program off the people in Oklahoma, and it works, and it's working. Now I've got several announcements. I'm going to go through these pretty quickly. Yesterday, Nucor got their air quality permit for their facility in Mason County. We got it in a record time. That was great. Nucor is absolutely going to be a total non-emissions type, location and everything. Air quality is supposed to be terrific and everything. We're very, very, very proud to have these people as partners, and it just goes to show how great state agencies can work through, cross every T, dot every I, make sure everything is exactly right, all above board. We don't have to be like every state in the country and everything where it takes, forever and a day to get anything done. We get stuff done in West Virginia, and we do it right. And I commend our DEP, Secretary Harold Ward, and they've done great work in this regard. And this facility is going to provide an incredible amount of jobs, an unbelievable amount of jobs, and do so while absolutely doing great stuff for the environment as well. It's an unbelievable facility, unbelievable accomplishment by the DEP, and let's just keep moving forward. And we want to welcome any and everybody to give West Virginia a look. We do good stuff, we do it right, and we do it fast, and we don't do it, as a bunch of bureaucrats in West Virginia. So give us a look. From the standpoint of the Harmony Grove exit and everything, I announced that I am pledging the state of West Virginia's full support for the proposed project to construct a new interchange off Interstate 79 in the Harmony Grove area near Morgantown. This area is just absolutely just perfect for more and more and more growth opportunity and everything. I am proposing our entire support. There's a lot of hoops we've got to still jump through. We've got to see, that the dollars, will all match and everything, and the project just won't be a runaway project, but I really believe we can get this done. And this will only make things better in Morgantown, and that area is growing like crazy and doing all kinds of wonderful stuff, and we want to absolutely be supportive. And so we're really proud to be able to announce, that Harmony Grove exit's on the way. And we just got to make sure we jump through the hoops and get it in the right posture and get it there. I'm going to maybe mispronounce this, but it's Vaccinate. And, we were in Wheeling yesterday. We were there with U.S. Representative David McKinley, and Senator Ryan was there as well. And this company is doing so many high-tech things, it's off the chart. What they're doing is they're not only taking coal and making incredible strong products that are super lightweight and super durable out of pure coal, but in addition to all that, they're now working on a process that makes it's so high tech, it's over my head in many ways, but what they're doing is they are making a product that gives a product the strength capabilities of 5 times better than steel. And with all of that, what it does is it basically condenses the molecules in the product and makes the molecules fit tighter together, and that in essence gives strength like you can't imagine. It's all about metal alloys and all kinds of stuff, but this, the fellow that was there that heads up the whole show is Brian Joseph, and Brian, is an incredible brain and an incredible good man. Touchstone is already there, and the research lab is already there doing unbelievable work. They've got a $5 million grant from the Department of Energy, and it's all happening in West Virginia. That's the thing that just blows me away. We would all think this ought to be a Silicon Valley, project or something like that, but it's happening in West Virginia, and that draws an incredible look on West Virginia by many that are out there that are absolutely now looking to see, well, dag, maybe West Virginia is that diamond that we missed. And so with that, they're expecting an additional 200 to 300 new jobs in the area. It's just good stuff, I thank Congressman McKinley. I really believe we wouldn't have got across this finish line without him. I also thank our senators, Senator Manchin, Senator Capito, and Congressman Mooney and Congressman Miller. So all this is just again, just tribute to just all the neat stuff that's happening in West Virginia. And, I just keep saying, pour it on. It's just better and better and better. And I may mispronounce this too, but I think it's Comores, is doing a partnership now with Workforce and with the West Virginia Community and Technical College System. And what they're doing is they're going to absolutely, with their employees, they're going to make it, the partnership that they're putting together is going to provide the opportunity for more than 300 West Virginia Comores employees to earn their associate degree by the fall of 2025. And this is just going to make them better trained. It is absolutely working with our community and technical college in a great way as Workforce. In addition to that, it is an incredible partnership from an unbelievable company. And so, I don't know how you thank people that decide that they're in West Virginia, they love what's going on in West Virginia, and they want to step up. They want to step up and do more goodness and everything. It's just like Nucor giving $1 million, I think, to the Board of Education down there and all the stuff they're doing. It is so many things where people are stepping up because they want to embrace community. They want to embrace the love of their neighbors and try to take care and be good citizens, good citizens to our state. Just a couple more announcements and everything. We were at Pipestem the other day, you know, all the park renovations, but they're going out and telling our message, absolutely changing our image every step of the way. So right there is where we're cutting the ribbon, and I just don't know. And on top of that, you know, this is one of the rooms that was remodeled and everything. I don't know if you can see it really well, but you can't imagine the view right there. It is spectacular beyond all comparison. So we congratulate the people over at Pipestem, and you know, good day. I would say we've spent $151 million on our parks. Let's find a way to spend a whole bunch more, because the more we spend, the more we're going to bring in, and the more we spend, the more people are going to come. And so let's just keep doing it as prudently as we possibly can. We don't throw away a dime here. That's exactly the motto that we want to be carrying all the time, but at the same time, we want to do the good stuff that perpetuates West Virginia. Last thing I have, and this is something you got to pay real close attention to me about. This is not a celebration of an announcement, but this is our state of preparedness. You know, we're expecting some heavy rain and possible flooding over the weekend, and I'm declaring a state of preparedness right now for all 55 counties today. You know, with the threat of flooding, we've all got to realize that no matter what we do in West Virginia, we still have these mountains, and these mountains are steep. And you know, when the water starts coming and the water comes off these mountains and comes off these mountains steep, there's no way we can avoid all flooding. So with all that being said, we've got to be really careful, and we've got to coordinate with all the agencies and just make sure that we stay as safe as we can. Be really careful about driving through water. It's absolutely risky, and you really should not do that. So with all that being said, that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And in support of what the governor said, there's some recent information that really is just so important for all people in West Virginia and all people in our country to really be aware of. And that data has to do with the very, very real still risk to really specific populations to have the most severe consequences from COVID-19 infection, including hospitalization and death. And that is for our elders. And what's become very clear is that not only is it important to get your vaccines, and of course, we absolutely want everyone who hasn't been vaccinated to please consider getting vaccinated, but particularly for our elders, for our folks over 50 and 60 and 65 to 70, we know that the duration from the last vaccine that you've had does give you a higher risk of loss of potency from that vaccine. And some important data that's come out of Israel says that if you're a normal person who is eligible for booster shots, then getting your third shot, your first booster shot, is important and reduces your risk of severe disease and dying about a third. And if you follow that over several months, we know that that number starts to go back up a little bit again after 4 to 6 months or so. But getting your next booster shot at that point, if you're eligible in the United States over 50 years old, further reduces that, by another third. So that gives you a 9-fold reduction in the risk of severe disease and death from people that have only had 2 shots. This is not unvaccinated. These are people with just 2 shots, and particularly in elders. And we're really seeing, as the governor said, the brunt of the impact of COVID-19 now, particularly with the Omicron variant being very much focused on older Americans, older West Virginians. And so it's really, really critical that if you are in that older age category, which in the United States is really over 50, in West Virginia, 95% of our deaths have been in West Virginians over 50 years old, then we really want people to consider that, being up to date with your vaccines. And if that's a second booster shot or your fourth total shot, then that gives you the most protection that you can have. The other couple things that have been found is, and we've talked about this previously, but a new study done by the World Health Organization looked at all of the deaths from COVID and also excess deaths that every country reports. And 10 countries, including the United States, accounted for 68% of these excess deaths. And in the United States, our excess deaths have gone up higher in 2021 than they were in 2020. Many countries had higher numbers in 2020 because of the availability, the lack of availability to the vaccines that we've had. But in 2021, even though we've had the vaccines, our numbers went up. But the World Health Organization they project that we've had about 15 million deaths worldwide from COVID-19, as opposed to the number that they report officially, which I believe is right over 6 million deaths, which is still just a tremendous number of deaths. The other thing that is really important to know is that in the US, we are going to approach 1 million deaths directly from COVID. And we know that those excess deaths make the true number of deaths that have been related to COVID much higher. We know that this is in older Americans primarily. So please, again, get your booster and be cognizant of that. The last thing is there's more and more that's coming out around long COVID. And it's really clear that if you've had really severe illness with COVID, been in the hospital, been in the ICU, your risk of having long COVID-like symptoms are much higher. But even in people that just have very subtle infection, get better, in many studies now, they're reporting up to 30% of people who have had relatively mild COVID symptoms and gotten better do get long COVID symptoms. And now more and more, we're seeing that children are also at risk for having this same problem. So another reason to be careful to get your vaccines, to get your boosters, is because we know that also reduces your risk of developing symptoms of long COVID. So for all reasons, please go to the vaccine calculator, make sure that you know what you're supposed to have, and please stay up to date with your vaccines. It makes a meaningful difference to all of us because it reduces some of the risk of spread of COVID-19, but particularly it saves the lives of the people that are the most vulnerable. And those are lives of people that we can't afford to keep losing. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. Just a couple of data points to reinforce what the governor, and Dr. Marsh have pointed out. Working with our data team this morning, the numbers that we're seeing in West Virginia with the increase in the RT value, increase in hospitalizations and cases, we believe right now is not the national surge that is out there in other states, but a spike that has come what we normally see after holidays. And if you think about the number of school spring break trips as well as Easter, we believe that is what is influencing our current numbers right now. So we still, West Virginia, could see in the next 3 to 4 weeks that broader national surge, because we tend to be about 3 to 4 weeks behind in those numbers. So again, bring that up to reinforce what the governor and Dr. Marsh have pointed out. Exceptionally important to stay up to date on vaccines, particularly for West Virginians over 50. So if you're going to be traveling with family and grandchildren this summer, really important to stay up to date. Remember that the 1918 pandemic, when we had a much smaller population and was less mobile than today, lasted from February 1918 to April 1920 before it was considered endemic. So we have a ways to go. We've got to continue to be prepared. The last thing I'd leave you with, some good news, and part of the reason that the governor continues to press this education effort on vaccines. From April 6th to May 6th, we had 6,481 West Virginians who took the time to be educated on the value of the vaccine and went out and got their first dose of the vaccine. So we continue to make progress with that and with our third and fourth shots, and we will continue to press and make them available to all West Virginians. Thank you.
Thank you, sir. Dr. Ainamjad, our state health officer, is also joining us today and is available for questions. Secretary Crouch had prior engagement today and will rejoin us next week. We'll go to questions from members of the media now. Our first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. General Hoyer, could you expand a little bit on what you just said? What exactly in the data did we look at that indicated that this current surge is from the holidays? Thank you.
General, please.
Yes, sir. Governor, is that okay to go ahead?
Yeah, please, sir.
So, Charles, we've got a really exceptionally good data analytics team that looks at the trends in the transmission rate, that RT value that the governor and Dr. Marsh, Dr. Amjad talk about, as well as looking at hospitalization numbers. And they look at this across areas, as we discussed, from holidays that we've seen over the last 2 years of doing this and travel. And that is what has led us to look at this as a spike as opposed to a trending in numbers of the national surge that we're seeing in other states right now. We'll continue to stay on those numbers. It's becoming increasingly challenging for the data team to look at things because of the testing numbers. So that's why we'll continue to stay focused on hospitalizations going forward to make sure that we maintain the integrity of our system. Thank you.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, first of all, I wanted to know if you had any update on that waterline situation in Piedmont. The second question, which is maybe a little bit related to that, is more of a general economic development question. When you recruit a business like Nucor, that's traditional economic development effort. But in the next decades, what I see, and I think you see the same thing, is that we're going to see more people working from home and a better opportunity for people to work from a place like West Virginia instead of heading to an urban area, which is more beautiful, to be honest with you. I know Mark Curtis puts up pictures all the time of sunsets around Charleston. I'd rather see that. I'd rather see that view you showed out the hotel room than anything else. Is there an economic development initiative underway that would target people on a one-to-one basis to come to West Virginia and make it home? Thank you.
Paul, I think we're doing all kinds of stuff. Well, you know, within the tourism department at this point in time, there's other different organizations, that within our government that are working on different approaches and all that. But Paul, let me just say just this. This is my 2 cents. West Virginia should never forget their natural resources, and we should be proud of our pond in that. But we should strive towards diversification every day, and I've done that since I walked in the door. With that, whether it be high tech, higher ed, manufacturing, tourism, whatever it may be, we're trying to grow all across the board. Just the other day, at the meeting that we had, or the event we had in Wheeling, here you've got a high tech firm that is I mean, it is beyond belief what they're trying to be able to achieve right there in Wheeling. Now, with all that being said, Paul, your question was more centered around, you know, with more and more and more folks working at home, is West Virginia not poised to take more advantage of that than you would be sitting in an apartment in the middle of New York City? And absolutely, without any question, we are more poised for that. You know, I've said it so many times, you can have the job of a lifetime now in West Virginia, and you can live in paradise. And so how we market that and what we do and everything will be another challenge, another step forward. And Paul, you're dead on the money right. Dead on the money right. There's going to be more and more and more gigantic opportunities for West Virginia if we'll just open our eyes and move on. Think of the Ascend program that we just, with Brad Smith and with WVU and all the good stuff that are going on with that program. You know, and I'm going to misspeak on this and everything, but we opened it up for just a few spots in, I think, 2, if not 3 communities so far. Like 50 spots. I think Morgantown was one of the communities. The third one on the line was Lewisburg. I don't really recall. Maybe somebody can help me with the second one. But I think it was Fayetteville, if I'm correct. But nevertheless, in those communities, we were overrun with people wanting to come to West Virginia. You know, now, Paul, you're splitting the bullseye. We are knocking it out of the park with tourism. We're having people step up like Brad Smith and all the great stuff that's going on right there. You know, but Paul, we are still, with all the good stuff that we have, in my opinion, we're still just getting the parsley around the sides of the plate. The real meat and potatoes is still there for us. There is so much still right there, right for the taking. Now, going back, Paul, in regard to the project at Piedmont and all that and everything, the city's trying to find the resources, or the source of the water. It's a very complicated and they're working on it hard. I don't know any more than that right now. Our people are all over it and everything, but the PSC is greatly involved, and we're going to stay right on top of it and everything and get to the bottom of it. Now, that sounds like a political answer, but Paul, I'm giving you everything that I know right now.
All right, thanks, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and staff. And thanks to Paul Mullen for the shout out about my sunset photography. I live at about 1,000 feet up in the Edgewood area. The sunsets are spectacular. I've been in 46 of the 50 states, and I can say hands down, this is the most beautiful state in the country. Governor, I do have to ask you a non-COVID question today. Given the leak of the Supreme Court document purporting to overturn Roe v. Wade, have you had any discussion with the Attorney General, the legislative leaders, about whether you'll have to call the legislature back into special session to deal with any state laws regarding abortion practices if a Roe v. Wade is indeed overturned?
Well, Mark, I have not had the conversation as of yet, and I've purposely not had it as of yet. I would welcome, to speak with anybody and everybody if they call and and want to talk about it. But the bottom line of the whole thing is, I think we need to always be prudent in what we're doing and not jump to conclusions, until the official word comes down from the mountain. And it's not down yet, is it? And so with all that being said, I think everybody is standing waiting. I want everybody to understand wholeheartedly. My wishes are absolutely stand with life, period. That's all there is to it. Stand with life. For as far as calling the legislature back into special session, we'll have a bunch of dialogue and we'll have time and everything to be able to do just that. But my feelings are easy, and I say stand with life. But there's a lot of people that got to weigh into this, and we really need to wait and let the process work its way as it should, and work its way down to us before we start running through the streets saying we're going to do this or not do this or whatever it may be. You know, that's my opinion, and I think we've done that all along. We've done that since the day I've walked in the door. We've not reacted spontaneously. We have reacted prudently, and really and truly, I think that's what you'll see that we'll do again on this as well.
All right, thank you, Mark. Governor, I'll turn it back to you.
You know, again, and I say it over and over, but I really try really hard to listen to all the experts and all the good stuff that they have to say. General Hoyer, don't leave right yet. If you're still there, I want you to say to our people again, the number of people, you made a comment about the number of people that we were getting across, or we'd gotten across the finish line on their first shot and everything, and how important that is, and then I'll elaborate on it in just a few minutes. But General, are you still with us?
Yes, sir, Governor. Yeah, from April the 6th to today, May 6th, we've had 6,481 West Virginians who, based on the education efforts you're doing, went out and got a first dose of the vaccine.
You know, I always include all the stuff, all my notes for the briefing, all my stuff that, you know, that I write down here, and I guess it all goes into some kind of archives and everything. But I wanted to write that number down, and I wanted you all to hear it one more time. Now, can you just imagine it? Now, let's just be really fair again. Really, really fair. We're dealing with all kinds of stuff, whether it be Roe v. Wade, whether it be, you know, the near-term elections that are going to come up, you know, just, you know, no matter what it may be, you know, whether it be a new core or whether it be what, you know, all kinds of different things, you know, the park renovations, on and on and on. But we still got people dying in West Virginia, don't we? And a lot of them. We lost 10 additional people since the last time we were here. For all, you know, in the Sago mine disaster, as I've said so many times, we had 12 miners trapped. We lost 11, and then I don't know the fate of the last person, you know, at that time, but this is dadgum near equivalent to just that, and it's a good day. And we've had many, many days that are a lot worse than this. Just imagine, and please tell me just this. Of 6,481 people that have gotten their first shot in the last 30 days, in the last 30 days, 6,481 people per General Hoyer have gotten their first shot. Is it worth us coming in here and talking about it? Is it worth us coming in here urging people to get these shots? At the end of the day, how many of these people, how many of the 6,481 did we save their life? How many? Is it one? Is it 600? How many is it? If it's one, it's absolutely way good enough for me, for us to be here pushing everybody to try to get them across the finish line. But in all reality, we know it's not just one. It could be 60. Who knows how many it could be? It could be another Sago mine disaster equivalent. Without any question, all of us, every last one of us, the experts that are on, nobody wants to be here doing this right now. We all want to be out trying to chase the next new core, or trying to do the goodness for our state parks, or trying to do the goodness, you know, in double the potential number of fish, you know, for our streams. Whatever it may be, handling the surpluses, we don't want to be here over and over and over, except for one thing. We're saving lives. And absolutely, you can help us do that too. 6,481 people got their first shot in the last 30 days. How many people did we save their life? Is it not worth it? Of course it is. Of course it is. I can't thank everybody that has been working side by side with me through all this terrible pandemic enough, especially those that ran to the fire and are continuing to do exactly that. We're going to get there. I firmly believe, live your life. Live your life. Learn to live with this. Absolutely, I tell you with all in me to get your vaccines. But nevertheless, I say I'm going to respect your wishes, and I will always stand firm by that. Now, with that being said, last words, and I can't say it any more bluntly. Look, I just turned 71 years old. I had COVID a few months back. I'd had all my vaccines and all my booster. And at that point in time, it really was really tough. For 2 days, it was really tough. Did I really think that I maybe could die? Not necessarily. I felt confident in the vaccines and what they would do. And literally, after 2 days, it turned like that, and I was back on the mend. Now, absolutely, I've got to tell you that if you're 50 and older and you are up for your vaccine, your booster, you got to go do that right now. You got to do it for me, for baby dog. You got to do it for all of us. But more than importantly, you've got to do it for your loved ones, and you got to do it for yourself. Now, I don't mean to go on and on. 6,481 stepped up for the first time. All you've got to do is go get your booster. You've already been there. Without any question, you've got to do it. This thing is starting to slip just a little bit. We've got over 1,000 active cases now. We've got 7 yellow counties in West Virginia now. We can beat this thing down, period. The only tool we got in the toolbox is the vaccine. That's the only tool in the toolbox. You got to take advantage. Thank you so much.